All my bags are packed, I'm ready to go. Before you go, I don't know the words to the song. Why is it in my head? It looks good today. Let's do this. Good morning, good morning. Hi guys. Long time no see of anyone. Social isolation sucks. Hello friends, I am Becky. Welcome to my channel. Today we are doing a third trimester overview, recap. We're gonna talk about the third trimester. So this is my third trimester with my third baby girl. I'm going to update you guys, tell you how this third trimester has been. I'm currently 38 weeks and I could go at any point in time. So if you haven't seen my first trimester or my second trimester video, I will link them below, put them in the cards above my head, so you can watch those first, or just if you're concerned about the third trimester and you just want to watch this one, that's totally fine. Totally fine. You do you. So first things first, being pregnant during the coronavirus, global pandemic, social isolation, stay at home order, like, oh my gosh, this is the worst time ever to be pregnant. And I will tell you some of the reasons real quick before I get into like the normal fun symptoms, all that kind of stuff. First, we want to talk about COVID-19 and how it has changed this pregnancy. I am obviously, like I said, I could go at any time. I am currently 38 weeks and totally out of breath. Hold on. You might be hearing me huffing and puffing throughout this entire video. Don't be concerned. I don't have the corona bona crap. I'm just pregnant, guys. I'm just really super pregnant. Basically, it's a really scary time to be pregnant. We're all on social media. We see all the articles. We read all the things. We don't know if it's true, false, what. But I am in a few Facebook groups for pregnant women right now, and we kind of go back and forth supporting each other and talking about all the changes that are going on around the nation with hospitals and deliveries and appointments and all that kind of stuff, because it's all changed, all of it, and it's scary. For those of you that don't know, I am type 1 diabetic, so that makes me super prone to catching anything, basically. I kind of hide out all winter just because of the flu. So I am super vulnerable to catching this disease or anything else. I'm also pregnant with cancer, and so my immune system is not the greatest right now. Am I in fear of getting this virus? Of course I am. Duh. Am I in fear of dying from this virus? No, I'm not. I know that I am doing everything that I can to keep myself healthy right now, and also because I trust that God has his plan, and this baby coming, I believe that he wants me to enjoy this baby as well as the rest of my family. So, and I'm just not afraid of death. That's the reality. The death is part of my life every single day, because I lost my firstborn when she was just 3 months old. So death is just a part of me. I'm not scared of it. I actually look forward to it someday, but not anytime soon. Not until I've met my grandchildren and my grandchildren's grandchildren. That's just me. So, no negative comments. Thank you very much. What I am in fear of every day is that this baby will be born and possibly catch it. If I were to get it, if my husband were to get it, if my daughter were to catch it somewhere, somehow, or even at the hospital. You guys, just going to the hospital and delivering is my biggest fear right now. I am in fear of losing this child. I think that just comes from me already losing my baby, and this baby catching the virus. I'll just leave it at that. I have my faith and my trust in God, and I know that he knows our plan already, and his plan is always good. So that being said, yes, am I nervous? Yes, do I have fear? I am human, but I also have faith, and I also have trust and hope that we're gonna come home. We're all gonna be healthy after this baby is delivered, and this baby is gonna grow and thrive and be happy, and it's gonna be beautiful when she's here. And oh my gosh, I cannot wait. I think it was like 30 weeks, 31 weeks. I'd have to look to recheck, but I think I was around that when the stay-at-home order like went into effect. So, you know, I started getting phone calls from the clinic saying, hey, you know, we're having to change some policies. You know, you can't bring anybody with you to your appointments, just you. This, for some women that aren't high risk like I am, they're being told that they're not gonna have any appointments at all. Which would totally freak me out. I guess that's another weird thing that I'm thankful for, is that I'm high risk and I do get to have appointments. That's a little morbid. I've had appointments every single week. A BPP ultrasound that I have to pass every single week from 32 weeks on to the very end, and then NSTs, which are stress tests. They wrap those things around your belly and they measure your contractions, but also are measuring baby's kicks and movement and heart rate, all that kind of stuff. I had this with my other 2 pregnancies too, because I've been high risk for all 3 of them. Obviously, because I'm type 1 diabetic. I had 1 NST at 32 weeks, and then from then on, they canceled all the NSTs, so they were just doing an ultrasound every week, which was actually kind of nice because I got to like go and see baby every week and know that she's okay, she's fine, everything's fine. So as long as she would pass that test, all the things, all the movement, amniotic fluid, practice breathing, all that kind of stuff, as long as she passed that, we're good to go for the next week. And I've been seeing, actually not my OBGYN every week, because they used to have like 10 OBs on every day. And since this has all started, they've only had like 3, which is a dramatic, yeah, that's a lot less. So I haven't really seen my OB. I've been seeing a different doctor every single time, which is really hard, because I am inside my head so much that I have so many questions that are very personal for my own OB, because I love her so much. It's just a comfort level. But I've been seeing an OB every other week when I go in. Going into the clinic every week has really been hard. Of course, I have my own mask that I wear and I wash every single week, and they do require it now. They have you keep it on the whole time that you're there, which is fine. I'm going to follow all of that because I don't want to take my chances. And I know that's kind of, the mask thing is ridiculously controversial. Get over it, people. I'm required to wear one to the clinic. Every single woman is. That's just the reality. As far as the hospital's policies, I know that they are different all the way around the nation. I've been talking to women in New York and California, and everybody's hospital has a different policy. And the policy at my hospital, as far as I know, this stuff changes every week. I am allowed 1 visitor, hallelujah, because I was scared for a very long time that I wouldn't even have my husband to come to the hospital with me. I can't have my doula anymore. And we can't have any other visitors. So we can't have grandma and grandpa. We can't have Amelia come and meet her sister at the hospital, which I was sad at first hearing that, but now I'm just kind of like, you know what, it's okay. Because I don't want anybody to get sick. I don't want anybody, you know, let's have as few people come as possible, right? Coming home will be a very, very difficult time. With the whole social isolation thing. We're gonna have to make some hard decisions and tell lots of family and friends that right now they just can't meet baby. And breaks my heart. It really does. Because that's part of my favorite part about, you know, bringing baby home and friends coming to meet her. But it is what it is, and we're gonna do what we have to do to keep this baby healthy, and to keep us all healthy. So as far as anything else weird and wonky in my hospital, they've explained to me that the only big difference is going to be that everybody's just gonna be wearing masks. But my mom and my sister-in-law planned this whole donut themed baby shower for me back in March, and we decided to cancel it because of everything. I didn't get to have a baby shower. I'm super bummed sad about that. But I still made donuts and I still ate them all. But my friends, my family, they all got me the things that we needed: diapers, wipes, you know, all the essential kind of things, like this really cool bassinet. We also, this used to be Amelia's room, and so we converted it back into a baby room as well as the crib. We put back together, so that's all set. And then we also made a brand new room for Amelia. So she has a big girl room. I painted the coolest wall. Like, she was very specific. She's like, Mom, I want a purple wall with big pink hearts. I'm like, how am I gonna do that? But I figured it out, and I think I did a pretty good job. As far as how I've been feeling this third trimester, I experienced this with all three girls. I get really nauseated. Now, I was nauseated in my first trimester, but this is a whole new level. Like, I am nauseated all the time, whether I am standing, especially when I'm standing, actually. Or if I'm sitting, I'll get nauseated. Sometimes I get a lot of back pain and I get nauseated from that. Sometimes I'm just nauseated laying on my side in bed in the middle of the night. I'll wake up with nausea. It's the weirdest, most terrible thing. But I've had it with all three. Kind of expected it. It happened anyway. So my back pain been really bad. Now, the beginning of my third trimester, she was sitting really up, really high in my ribs, making it really hard to breathe, totally uncomfortable, also adding to my nausea. But I've been having, like, I'll just stand up for a second. Yeah. So, like, she was like even higher than this, like way up here. Like, she's dropped a little bit, but I used to have, so like the bulk of her like bottom is like right here, then directly behind it, my back, this is where I have the most of my back soreness and fatigue and such. So I have a lot of back pain there. Not so much the lower back, which is weird, but now that I'm having like cramps pretty much every day, all the time. They're definitely not consistent, so I'm not in labor, friends, don't worry. Wish I was, though. I've also talked about my SI injury, and my back is kind of, the SI is kind of between your hip and like lower back area, buttocks kind of area, so on the right side. And I had that since I was in a car accident like a year and a half ago. No, 2 years ago, actually. 2 years in June. And so that's been acting up a lot more, like getting a lot worse with pain. I have been wearing a belt, like a maternity belt, and that's helped sometimes, but it feels really restricting and really tight and uncomfortable most of the time. I don't know. Sometimes I wear it. Sometimes I'm just like, get that off of me. The shortness of breath. All the time. All the time. Especially stairs. Like, what the heck is it with stairs and pregnant people? Like, why? I can do my regular workouts. I can lift weights. I can jump around. I can do yoga and walking, and I'm just fine. But when I go upstairs, I feel like I'm gonna have a heart attack. It's ridiculous. So if you know why stairs are so hard for pregnant ladies, please comment below, because I would really like to know. Lots of swelling. I can't even wear my wedding rings anymore. My feet are swollen. I don't have a darn shoe that fits me right now, but I refuse to go out and buy a new shoe just for like wearing for a month or two. Yes, hemorrhoids. It's kind of a given toward the end, especially because everything is coming down. It's pushing down on everything. And so the hemorrhoids just, they get swollen. Am I constipated? No, actually. I'm happy to report that I go number 2 every single morning. That's not something to be excited about. Sleeping is hard. I don't get very good sleep anymore. My second trimester was pretty good for sleep, actually. But as far as like positioning, usually my hips get really sore. So I have to go from one side to the other, back and forth, like literally all night. I do get up at least once a night, sometimes twice a night, to go to the bathroom because bladders, no room. There's no room. SPD. Symphysis pubis dysfunction. That's fun to say. I've never experienced this before. Never. And it is very painful. It basically is your pubic bone separating. You can read all about it if you so choose. But basically it feels like your pelvis is just being torn and crushed like apart, and it's like in your groin area. Like, this has been going on for the past month and just getting worse and worse. I'm still doing workouts and such, but I have definitely dialed it down a lot because of this. When it started getting nice out in Minnesota, I would take walks every day, right? And then I started feeling like this pulling, like almost like a pulled groin muscle. So it was like, oh, I totally pulled my groin. It sucks. But that's what I thought it was. And then it just continued to get worse. And now I'm at this point where it hurts to like turn at night. Normally I sit with like Amelia on the floor with my legs crisscrossed. I can't do that anymore. So basically you have to keep your legs together all the time, which is really hard with a big belly. Lastly, the last thing I can think of to update you on is my 30 pound weight gain, which is actually pretty average for most women. I think is like 30 to 35 pounds is pretty average. And that's what I remember gaining with both Gracia and Amelia, was like 35 pounds. And if you've had a baby before, you lose like 10 pounds like that first day. With the vegan diet this time, I believe that it's gonna be a little bit easier. But we'll see. I'll keep you updated on that journey. But that'll kind of be like my next journey that I film for you guys. Yeah, it's just, it's all part of this. And I'm gonna take my time with it. I'm not gonna go to extremes like I have in the past with dieting. I don't believe in dieting anymore. Just eat real food, friends. And eat as much of it as you care for. That's it. Just eat whole foods as much as you care for. I'm gonna do just that and take care of my baby and take care of my other baby who is 6 years old and taking care of my other baby who is 34 years old. But oh my gosh, you guys, like if this happened today, I would be so happy because I'm just so over being pregnant. I do not deal with pregnancy very well. I do not like it. I don't enjoy it. It's uncomfortable. I'm so just ready to have the baby cuddles. I'm so ready for her to be here. I'm not going to do like a labor delivery kind of video, just not into that. But I will be taking my camera with me and doing lots of fun shots of her, making a really creative, beautiful video that you guys can enjoy, but so can I. So, and that is how we're going to introduce baby girl to everybody. So thank you guys for watching and taking this little journey with me. Because of this cancer, this baby wasn't supposed to happen. And she's been such a blessing already in our lives and such a miracle. I couldn't be more grateful. As hard as this pregnancy has been and continues to be, I couldn't be more grateful. Thank you for watching. I'll see you guys in the next one. Go spread some happy. Bye.